Madam Speaker, government is further investing a total of $387.6 million in improving access to quality medical services, an increase of more than $100 million. First priority is to recruit 200 additional nurses and 350 doctors. This is a significant investment, Madam Speaker, towards improving medical services to internationally accepted levels. The hiring of doctors will be done in 3 trenches, Madam Speaker. First, 44 specialists will be recruited for divisional, sub-divisional and specialist hospitals. In the second trench, 143 doctors will be recruited for the frontline and operational services. These positions have already been advertised. The remaining 163 doctors will be recruited in the third trench. Around $59 million has been allocated for doctors' salaries. A total of $32.5 million is provided for the purchase of drugs, consumables and vaccines, and an additional $5.3 million for laboratories. Madam Speaker, a sum of $47.8 million is to upgrade, extend and maintain existing health facilities, build new facilities and equip all these facilities. We have further funded, Madam Speaker, a customer care centre with a toll-free number 157 that people can call with comments, complaints or compliments about the treatment in our health facilities. And we are keen to extend, Madam Speaker, the services of such a centre for other ministries that directly serve large numbers of people. Madam Speaker, government is working with the International Finance Corporation to expand the range of services at Lautoka Hospital and Bar Hospital through a public-private partnership. Their current plans for the hospitals will bring them up to full international standards, and government will seek bids with the assistance of ISC and the Indian government for an international hospital company to run the hospitals and provide enhanced tertiary care facilities. Indeed, the Indian government, we like to acknowledge them, has also given an undertaking when he met our Honourable Prime Minister, Prime Minister Modi, when we met our Honourable Prime Minister in Fiji, to also provide state-of-the-art equipment for this public-private partnership. We expect to select the partner and sign the agreement by February of 2018. Government will continue to subsidise costs for low-income earners at these hospitals, Madam Speaker. We will allocate, Madam Speaker, $1 million to establish and equip the National Kidney Research and Treatment Centre in Suva, to be directed by Dr. Amrish Krishnan, the only Fijian nephrologist in Fiji. This treatment and research centre will advance the treatment of kidney disease in Fiji by operating 10 new kidney dialysis machines and offering a range of other therapies as well as diagnostics and counselling to its patients. 4 new kidney dialysis machines will also become operational in the Lautoka Hospital in the next few months. And Madam Speaker, we are extending the concern for good health to the workplace. One of the significant measures in this budget is to provide fringe benefit tax exemption to employers who provide medical insurance to their employees.